Hello everyone, I am Dr. Chandrakumar. I am consultant pediatrician and a neonatologist. So when it comes to child care, so three things are very important. Okay, so growth of the child, development of the child, and then vaccination of the child. Yeah, why these three things are important? If you ask, so our intention is to provide a normal growth and development of the child so that when child becomes an adult, he, he or she is physically fit, mentally fit, and is healthy to face the challenges of life. So to ensure proper growth, the first component which I told you, we need to give adequate nutrition to the baby. So the best thing which a mother, I would say rather a parent can ensure is providing exclusive breastfeeding for first 6 months of life. So after 6 months, breastfeeding should continue until 2 years of age along with appropriate complementary feeding which is as advised by your doctor. So this would ensure appropriate physical growth of the child. Next, after physical growth, what we need to ensure is child develops appropriately. What is development? Development means child is not only increasing in size, which is called as growth. So development means a child, in addition to growing in size, that is weight and height, also develops skills which are necessary as the child grows. It includes skills to stand, walk, that is to move around, skills which are important for finer things like fine movements like writing, drawing, these finer skills which is called as fine development, skill to communicate, that is the language and speech, then finally social skills, that is to behave appropriately in the society, at home, in the school, so all these things. So this all four domains of development are very important so that child develops into a appropriate individual. If there is any abnormality in these domains of development, especially if there is a delay in motor or fine motor development, it is very much evident for the parent and parent may seek help from the doctor. And it also includes speech delays. Okay, it is very quite evident for the parent. But the fourth domain which I told, that is social skills. Okay, if there is a concern in that, if the child is too aggressive, child is not listening to the parent, child is throwing lot of tantrums, or child is not interacting with other kids, child is too unresponsive, child is not paying attention to whenever the parent calls. So these are all some important red flag signs which you need to pay attention to. So if a child at 9 months of age is not responding when called by name is not a good sign. So you need to consult a doctor. So in addition to such signs, if the child is showing some repetitive behavior, doing the same thing repeatedly, is not comfortable in a crowded place where too many people are around. So these are all some of the red flag signs when it comes to development of the child, for which you need to seek the advice of a pediatrician. The third important thing which I told to ensure proper growth and development of the child is immunization. So you have to get your child vaccinated. So to get the to get complete protection for your child, you need to follow the vaccination schedule which is advised by your pediatrician. So vaccination starts as early as the day after birth and then it continues until almost 15 years of age. So there are some set of vaccines which are recommended only for children with some special conditions. There are some vaccines which are specially recommended for girl children, So these vaccines should be strictly adhered to so that you are able to provide appropriate protection from vaccine preventable diseases in children. So as I told you, these three areas are very important to ensure appropriate growth and development of your child, that is growth, development and vaccination. So please follow these three things after consulting your pediatrician and ensure a proper healthy life and future for your child. Thank you.